Morning, everybody. Fox's alert now. Get this. The head of a major American insurance company sounding the alarm on Obamacare. The head of Aetna warning that the third largest insurer in the country could be forced to raise their rates by double digits or drop from the law entirely. And what would that mean? Good morning, everybody. I'm Bill Hemmer. Welcome here to America's Newsroom. Hope you're warm wherever you are.
Yeah, pretty warm.
Another bombshell yet again, huh?
I know. Can you believe this? So there is more to tell you about it. I'm Martha McCallum. Good morning, everybody. So Aetna's CEO, Mark Bertolini, says that Obamacare is just not attracting enough of the uninsured people out there. Meanwhile, there's new documents that show deep fears inside the Obama administration that flaws in the system could doom the entire healthcare industry. But Kathleen Sebelius, at least outwardly, says she's not worried.
There are only 300 insurers in the whole country, and they have signed off on, we will get them paid. There's no question about that. So, but we're on track.
Well, I want to bring in Stuart Varney now, host of Varney & Company and FBN. Stuart, good morning to you.
Morning, Bill.
What do you think?
We will get them paid. Direct quote from Secretary Sebelius. Sounds an awful lot like a bailout, because there is that provision in Obamacare that if the insurance companies don't bring in enough money, the taxpayer will top it up. That's a bailout. It appears to me that that's what Secretary Sebelius was talking about there, a bailout.
So eventually they're just kind of, well, I guess for now anyway, they're guessing at these numbers. Back up a little bit, though. What's Aetna's problem? Explain that.
Aetna's problem is that they're not signing up uninsured people. The people that they're signing up already have insurance. They're just transferring to Aetna. That's not what was written into Obamacare. That's not what Obamacare is all about. Aetna wants new people signing up. They want young, healthy people signing up. They're not getting them. And they're saying, look, if it goes on like this, we've either got to drop out entirely or we've got to raise our premiums.
The point being, that was the income that the insurance companies were looking for by taking on new patients.
Right.
The uninsured moving to the insured roles. Right. But what is the government admitting to in this report that Jim Engel had last evening?
Yeah.
That he found in these documents? What's there, Stuart?
Okay, directly from Jim Engel on these documents. The back-end problems with the website, quote, put the entire health insurance industry at risk. It appears that the link between the website where you put your information on and the insurance companies, that link has not been built. That is the back end. And these documents conclude that the entire health reform is at risk. Now, that's dramatic stuff. That's chaos that we were talking about, chaos and confusion. It's happening now.
Some are suggesting that needs to be nailed down within the next 60 days, and you wonder if they can do that. But the back end, again, just to reinforce this, that's how the program, that's how the government talks to the insurance companies.
Yes.
So they know who has coverage and who does not.
Precisely.
I mean, that's a fundamental principle of the entire law.
Of course,
the entire system.
That's the structure. That's the structure of the system. If you can't communicate between you signing up and putting your information in there and the insurance company doesn't get that information, there's a classic breakdown right in the middle there, and the system really cannot function.
Well, it certainly is. One more point here. How many of the uninsured are now moving to the insurance pool? Was there a percentage?
I can do it the other way around. Between 65 and 80% of the people signing up already have insurance.
Got it. Okay.
That means the new customers that the insurance companies were relying on, they're not coming forward.
I saw a figure of 11%, and that's not going to cut it right now.
No.
When you're talking about 30 to 45 million without insurance. Stuart, thank you. See you at 9:20, okay? Sure. On Fox Business. Martha.
Well, Aetna's a very big fish in this pond, and when they speak, people should pay attention because they are a huge part of this market. There's a good chance that many of you have one of their insurance cards in your wallet. It's the third largest healthcare benefits company in the United States, provides benefits through employers and to workers in all 50 states of the country. Those health plans covering more than 22 million Americans and carrying more than 600,000 primary care doctors and specialists.
Aetna also saying that participation is a problem. As we mentioned there a moment ago with Stuart, the administration saying some 2.2 million Americans signed up before the start of the new year. That is way short of the 7 million the White House wants by the end of March. But more than 6 million Americans also received during this time period cancellation notices for a policy they had.